Good morning. Today I am discussing about clinical manifestation of nasal disease. Whenever there is problem with the nasal cavity or paranasal sinuses, you would observe that these clinical signs. You would observe nasal discharge, sneezing, stutter, facial deformity, and systemic signs of illness. Whenever the nasal discharge can be associated with the localized nasal disease or lower respiratory tract infection that include pneumonia, infectious tracheobronchitis, or nasal discharge can be associated with systemic disorders that include hypertension and coagulopathies. Nasal discharge can be serous, mucopurulent, or without hemorrhage or purely hemorrhagic. It could be purely hemorrhagic. Quantity and duration of nasal discharge is important. If there is very small amount of discharge and it is occasionally present, it can be seen in normal animal. But if there is large amount of discharge and with prolonged duration and it is typically watery discharges or serous discharge, it is seen in viral infection. So, mucopurulent discharge is ropey in consistency and it can be associated with foreign body, infectious agent, neoplasia, polyps, or whenever there is extension of disease from the oral cavity. So, in those cases, you would find the mucopurulent discharge. So, if this discharge is mucopurulent, along with the signs of lower respiratory tract, what are the signs of low respiratory tract infection that include cough, respiratory distress? You have to evaluate the lower airways and pulmonary parenchyma. Hem, Whenever there is mucopurulent discharge along with hemorrhage, it can be seen in any etiology. So, whenever there is discharge of pure blood or epistaxis. It can be seen in trauma, neoplasia, fungal infection, systemic bleeding disorders. Systemic bleeding disorders include vasculitis, thrombocytopenia, thrombocytopathy, ehrlichiosis, Mountain spotted fever, von Willebrand disease, and hypertension. So these are the conditions in which you observe pure blood through the nares, or you would observe epistaxis. What is the diagnostic approach in these cases? You take a history and you do physical examination of animal and evaluate, very important, you evaluate whether the process is acute or chronic. If acute process, it is most likely foreign body or viral. If in acute process body condition is remains good and there is sudden onset of clinical signs. In chronic process body condition gets deteriorated and signs present over a long period of time. uh, in chronic process you would see the neoplasia, fungal, right? If there is a history of gagging, retching, and reverse sneezing, you always rule out the mass or foreign body in the caudal nasopharynx. So, next point, you have to determine whether nasal discharge is unilateral or bilateral. Unilateral nasal discharge is observed in foreign body, polyps, tooth root abscess. Bilateral nasal discharge is observed in systemic disorder, infectious disease. In neoplasia, initially nasal discharge is unilateral, but whenever nasal septum gets destroyed, it becomes bilateral. Next point, you see whether there is ulceration and depigmentation of nasal planum is present or not. If it is present, it is most likely aspergillosis. If there is polypoid mass extruding from the external layers, it is most likely rhinosporidiosis in case of dog. But if there is polypoid mass protruding from external layer in case of cats, it is most likely seen in cryptococcosis. Then next point, you evaluate the head. In head, it include facial symmetry, teeth, gingiva, mandibular lymph node, hard and soft palate you have to evaluate. Then if there is mass beyond the nasal cavity, you would observe there is facial bone deformity. It is very important, and there is exophthalmos, bulging of the eyeball, and you are unable to retropulse the eyeball. So this is important point. If there is mass beyond the nasal cavity, you would observe the facial bone deformity, exophthalmos, and there is inability to retropulse the eyeball. If there is pain on the palpation of nasal bone, it is most likely associated with aspergillosis. Gingivitis, dental calculi, loose teeth, and if there is gingivitis, dental calculi, loose teeth are present, and pus in the gingival sulcus, it is most likely associated with tooth root abscess or oronasal fistula. So these are the basically findings you observe in various conditions. If there is foci of inflammation and hyperplastic gingiva in the dorsum of mouth, it is most likely associated with oronasal fistula. Then you have to examine the hard and soft palate. You have to see whether any deformity is there, erosions are there, erosion or ulceration is there, and you have to see the congenital effects like clefts are present in newborns. These are congenital defects or hypoplasia. Then very important, you have to evaluate the mandibular lymph nodes. Normally dogs, they have uh, larger mandibular lymph node because they have poor oral hygiene. So in when mandibular lymph node, they generally enlarged in active inflammation or neoplasia. Then you have to take FNAC of fine needle aspirate of the lymph nodes, and you could observe the various organisms like cryptococcus, and you have to observe the various cells like neoplastic cells or hyperplasia you observe in FNAC of mandibular lymph node. Then you have to do fundic examination. You can observe the chorioretinitis. It is seen in various conditions like ehrlichiosis, cryptococcosis, malignant lymphoma. Then in f- uh, ex- eye ophthalmoscopic examination, you can observe retinal detachment. Retinal detachment is seen in systemic hypertension or whenever there is mass extending to bony orbit. So these conditions, they cause retinal detachment. Whenever there is epistaxis, you have to evaluate the hemorrhages in various tissues like mucous membrane, skin. You have to ask about the history of feces, if feces are dark in color or there is fresh blood in the feces, it, right? You have to evaluate whether there is hematuria or RBC in the urine. So you have to evaluate the hemorrhages in the various organs or the tissues whenever there is epistaxis. When you find hemorrhages in various tissues, it is indicative of systemic bleeding disorder. Then you have to take history, do physical examination, that and signalment that decide your diagnostic plan. So if there is epistaxis, you do CBC, right? Coagulation profile, buccal mucosal bleeding test. ABP means arterial blood pressure, because if there is a high BP, it will cause epistaxis. If there is any bleeding disorder, any coagulopathy, it will cause epistaxis. Whenever there is thrombocytopenia that diagnosed on CBC, it will cause epistaxis. So various conditions. If you if there is a purebred dog, if animal presented with epistaxis of purebred, right, or prolonged bleeding, you would go for the von Willebrand factor in those cases, right? If uh, if there is a you suspect a leishmaniasis or Rocky Mountain spotted fever, where these diseases are endemic, are prevalent, where these diseases are prevalent or endemic, you evaluate these diseases by evaluating the titer. Then go for Bartonella analysis. Yeah, in intranasal disease, normally chest, you would find normal chest X-ray. But if you suspect primary bronchopulmonary or pulmonary involvement with cryptococcosis or rare metastasis from neoplastic disease, you would find the changes on chest X-ray. But if there is nasal disease, you would see the normal chest X-ray. Then go for cytology of nasal swab, right? It can be, you can observe cryptococcosis on cytology of nasal swab. These non-specific findings, you find bacteria. You would see the moderate to severe inflammation and proteinaceous background. And then do fungal titer. If you suspect aspergillosis, cryptococcosis, a single positive result signify active infection, but negative. If fungal titer is negative, found to be negative, it doesn't rule out fungal infection. Titer results must be interpreted in conjunction with the results of nasal imaging, rhinoscopy, nasal histology, and culture. Then do so these are the tests you do. First you do nasal radio, CT, computer tomography, then biopsy and rhinoscopy. Why imaging is done first? Because if you do biopsy, it will cause hemorrhage and it will obscure the details on imaging. Next reason why we do imaging first, imaging tells which area is suitable for biopsy, right? Which is your target part. This tells through imaging. This But if you suspect foreign body, then you do rhinoscopy first, right? City, you would see the nasal terminate bones and may allow identification of small masses that are not detectable on nasal radiography. Uh, MRI is more accurate than CT in assessment of soft tissues. Is more accurate than nasal radiography in determining the extent of nasal tumors. Then final test is frontal sinus exploration. If fluid or soft tissue opacity is evident on imaging, but in absence of diagnosis, then you explorate the frontal sinus, and you do exploratory rhinotomy with terminectomy. Then next clinical sign you observe on in nasal disease is sneezing. Sneezing, if there is intermittent sneezing or occasional sneezing, it is normal, considered normal. If there is persistent sneezing, it is considered abnormal. If there is acute, means there is sudden onset and it is persistent, you suspect foreign body, nasal mite, upper respiratory tract infection, or you suspect exposure to any irritant, either aerosols or powders, which are irritant. Uh, in foreign body, what type of history you observe? You observe either dog rooting in the ground, running through the field. So this kind of history you observe. You observe history whether there is exposure to aerosols or powders that are irritant. They will cause acute and persistent sneezing. All the diseases that cause nasal discharge, they should be considered in a sneezing, right? If foreign body or nasal mite is their dog paw at their nose, so this is the sign you may observe. uh, in foreign body, you would see the unilateral discharge. I told you, unilateral nasal discharge or mucopurulent nasal discharge. If foreign body in the caudal nasal pharynx, I told you, you would see these signs: gagging, retching. It is retching means it is trying to uh, expel something, or reverse sneezing is there. If there is bilateral nasal discharge, in bilateral nasal discharge, you suspect aerosols or powders which are irritant. Acute proximal sneezing. Uh, in acute proximal sneezing means proximal means That is for very few seconds. That means that doesn't interfere with the oxygenation. So you do rhinoscopy first. Because if you with time foreign body gets covered with the mucus or migrate deeply into the nasal passage. So if you suspect foreign body, first do rhinoscopy rather than imaging. Nasal mite you diagnose by rhinoscopy, right? Then next sign you observe in nasal disease is reverse sneezing. Reverse sneezing means proximal noisy inspiration, right? What is the definition of reverse sneezing? Proximal means that last only for few seconds or that doesn't interfere with oxygenation. So proximal noisy inspiration, that is reverse sneezing. So reverse sneezing can be seen in foreign body, nasopharyngeal inflammation, epiglottic entrapment of soft palate. Epiglottic entrapment of soft palate is idiopathic. It is seen in small breeds. Signs of epiglottic entrapment of soft palate can be associated with drinking, excitement, right? Uh, Reverse sneezing doesn't occur in upper respiratory tract obstruction. I told you it lasts only for few seconds. If there is obstruction, it continuously happens. So that's why I told you it doesn't occur in upper respiratory tract obstruction. So you have to take history, do physical exam to identify nasal or pharyngeal disorder. Further evaluation you have to do if there is syncope or exercise intolerance or signs of respiratory disease are reported or reverse sneezing is severe or progressive. Starter next clinical sign you observe in nasal disease. Starter, these are snorting sounds associated with breathing. Starter generally associated with upper airway obstruction, right? Uh, or it can be associated with the pharyngeal disease. Intranasal causes of stutter are is generally obstruction. Obstruction may be caused by any mass, blood clot, exudate, congenital deformity. Right. Thank you very much.